I'm Vinay. I'm a physician at the Henneport Hospital. And first of all, I want to acknowledge my team, my own Paul and Ray, who did their valuable contribution to this. Our focus is on hospital readmissions. And the current healthcare system faces a chronic malady called revolving door syndrome. What it means is when the patient leaves the hospital, 1 in 5 of the elderly patients will come back within 30 days. So this is not the right thing. And we believe that the first week is the most critical part of the recovery phase. And what it means, why should we even worry about it? Because you can see the magnitude. It's $26 billion for cost for the Medicare. And of this, 17 billion is something avoidable readmissions. And for the hospital, it's 2 to 3% penalty every year within the U.S. From the Medicare, and it amounts to around 2 to 3 million every year. So it's a lot of money to let it go. And also from the patient's perspective, when they're discharged from the hospital, no one wants to go back in right away. So, and what are the major culprits? Looking at the data, this congestive heart failure, and acute myocardial infarction, pneumonia, and orthopedic surgeries. These are only a few of the major issues. So how can we bridge the gap? Bridge the gap between the communication between the patient and the provider. There's also an issue with the patient compliance, and once the patient leaves the hospital, we lose the ability to monitor their care. So we propose a digital product where we can improve the efficiency by following the patient's symptoms, still continuing with their care, and improve compliance with their medications, and also at the same time we get some alerts where the patient or the caregiver can intervene. So I propose a IS tracker, which is an intelligent symptom tracker, and Paul, my friend, is going to take over from here.
Make sure I'm going in the right direction. Okay. So when we came together with this idea for the app, we decided we needed to come up with kind of a high level, what is this app going to be? We knew right off the bat it needed to be something that was free to the patient, it would need to be easy to use, and the key is having these alerts between the patient and the clinician, so real-time information can be captured and reacted to. So we knew it needed to be secure, it needs to be HIPAA compliant, and the data is going to need to be from the EMR. So this is two pieces, main pieces to this. The front end is going to be an app that the patient would be prescribed, just like you would prescribe a medication, they would be prescribed this app. And then on the back end, again, there would be this interface with the EMR that would allow us to communicate back and forth with that patient. Then again, the key is having the alerts and then real-time interaction with that patient. So back to the idea, this is that first week, right after somebody's been discharged, that we're most concerned about. So we want to make it simple. This app doesn't even have to live for much longer. So the IS tracker would have the alerts, it would talk about present, and whether they're approving, the patient summary, and then the back end. So we'll just click through.
Thank you, guys. Okay, who would like to go first?
So if it's linked directly to the hospital EMR, it's likely that you'll need more than one cell phone to get it. The patient themselves who may not be looking at their phone as often as they should when they get out of the hospital, and a relative or caregiver. Have you thought about how many different people will be able to access this data that are family members?
That's a good thought. First of all, not everyone has a phone, but as long as whoever has a phone should be able to use this. And we would like to target this mostly to the patients who are discharged from the hospital, and even the caregiver should have access to it. So of course, I think it's a good thought to have an access to someone else, but it's the patient who knows better as to what's going on in terms of the medication. So for now, I think to get started with the patient, and then later on expand it.
And we would have to investigate whether or not there was a HIPAA concern if you give it to a family member or something like that and ask them to intervene, but it's something we'd certainly look at.
So it's essentially a replacement for basically the hospital caseworker who's calling back?
Not a replacement, it would be a tool for them. So the care managers, this would be something that they would interact with. In each hospital system, there may be a little bit different roles for that, but that person that's operating in that role.
It just makes your work more efficient. And also alerts are the key, where the patient, if it's not doing well, the system is going to alert the care provider saying it's time to intervene.
One more question?
Anything else?
Okay. Thank you very much, Dan.